The recent floods in Bosnia and Herzegovina were devastating. Homes were destroyed, businesses ruined, and lives lost. The emotional toll was immense. People were in shock, grieving for what they had lost. The floods came quickly and unexpectedly. Many had little time to react, watching in horror as the water rose. The experience was terrifying, leaving many with lasting trauma. The immediate aftermath was chaotic. People were displaced, without shelter, food, or clean water. Rescue workers were stretched thin, trying to reach everyone in need. But even in the face of such adversity, the human spirit shone through. Neighbors helped neighbors, and strangers lent a helping hand. Communities came together to support those who had lost everything. The floods may have brought destruction, but they also brought out the best in humanity. Jablanica, Kiseljak, and Kraljevo were among the hardest hit by the floods. These once vibrant communities were transformed into scenes of devastation. In Jablanica, the Neretva River overflowed, inundating homes and businesses. The iconic bridge stood precariously above the swollen river. Kiseljak was scarred by landslides triggered by the heavy rains. The landslides destroyed homes, blocked roads, and isolated communities. Kraljevo, steeped in history, saw its cultural heritage sites damaged. The floods were a blow to the town's identity and a stark reminder of nature's fury. In the aftermath of the floods, the spirit of resilience shone brightly in the hearts of the Bosnian people. Despite losing their homes and possessions, they showed incredible strength and determination. Volunteers from across Bosnia and Herzegovina, and even from neighboring countries, flocked to the affected areas. They worked tirelessly alongside rescue crews, clearing debris and distributing aid. The outpouring of support was heartwarming. People opened their homes to those displaced, donated essentials, and organized fundraising events. The floods may have destroyed their homes, but they could not destroy the spirit of the Bosnian people. Their resilience and unwavering belief in the power of community were a testament to the strength of the human spirit. The emotional toll on first responders was immense. They worked tirelessly, witnessing firsthand the devastation and suffering. They faced unimaginable scenes of loss and despair. They risked their own lives to save others, often working long hours with little rest. They were the unsung heroes of the floods. Many experienced compassion fatigue, anxiety, depression, and PTSD. It is essential to recognize their sacrifices and provide them with the support they need to heal. Their emotional well-being is crucial for their continued service and recovery. Recognizing the urgent need for mental health support, the World Health Organization, or WHO, and other organizations mobilized resources. They trained local healthcare professionals on how to identify and address mental health concerns. They established mobile clinics to reach those in remote areas. They provided psychological support to first responders. The WHO emphasized the importance of psychosocial support as an integral part of the recovery process. They provided guidance on creating safe spaces for people to share their experiences and process their emotions. The WHO's efforts highlighted the importance of mental health in disaster recovery. Addressing the psychological and emotional needs of those affected is crucial for long-term healing and well-being. In the aftermath of the floods, it was essential to address the stigma surrounding mental health. First responders and healthcare workers need to know that it is acceptable to struggle and need support. Breaking the stigma requires open conversations, education, and a shift in perspective. Mental health is just as important as physical health, and seeking help is a sign of strength. The floods highlighted the need to support first responders, healthcare workers, and all those affected by disasters. They emphasized the importance of breaking the stigma surrounding mental health. By prioritizing mental health, we can build stronger, more resilient communities. Creating a culture of support and understanding is essential for long-term recovery.